so shoulder replacements are not nearly as common as lower extremity replacements. It's the same indications, it's the same idea. If you have a degenerative shoulder, a worn out shoulder, they're very painful, range of motion is limited often, you'll be weak. The shoulder replacement is to address that. It's a symptom control surgery again. One of the main differences is you don't walk on your hands, so the recovery is different. You're a little more independent, a little bit more mobile from the beginning. Some of the same kind of a goals as a knee replacement in terms of early range of motion and trying to prevent stiffness. That's kind of the initial focus. And there's kind of two main kinds of shoulder replacement. There's what we call a reverse shoulder replacement, which is primarily indicated with people that don't have intact rotator cuffs. If you tear your rotator cuff and it's not functioning, a regular or a primary shoulder replacement doesn't function just like your regular shoulder doesn't function. So if you have just straightforward osteoarthritis and intact rotator cuff, you get what we call a primary shoulder replacement. If you don't, you get what's called a reverse shoulder replacement, which you'll feel, rehab, recover very similarly. There are some subtle differences sort of in the expectations and sort of what we talk about going into that surgery. But just generally speaking, the goal is to get you back some pain control, get you back some function, and get your quality of life back to where you can do normal daily things.